So until now, the management strategies have been treating with off-label therapies, um, antihistamines, rifampin, ursodeoxycholic acid or UDCA, cholestyramine, and none of these off-label therapies really address the pruritus in a way that is meaningful for these patients. They kind of bounce in and out of these off-label therapies, ultimately ending up with liver transplant if it's refractory. The majority of patients will receive a liver transplant for pruritus, not for end-stage liver disease. There was a paper that recently came out by the GALA Natural History Study group. And this group has really a amazing clinical research database that has its arms around the world of these secondary and tertiary referral centers, showing that 69% of patients with Alagille syndrome who were transplanted for pruritus. After that, it's, I think, failure, growth failure and xanthomas. And then at the bottom of the list, there's a percentage of patients that do get transplanted for end-stage liver disease, but the majority of it is driven by cholestasis. So until now, it has been predominantly off-label usage and then liver transplant. And now we are very proud that, for 1 year, Livmarli or Maralixibat, which is IBAT inhibitor of Mirum, has been approved by the US FDA. And this drug lowers, what it does is as I was talking about, the 95% of our bile acids circulate during the day. And in these patients, they have an inability to drive the bile acids out of the liver into the gut. What this does is it starts to inhibit the transfer of bile acids to go around, and it eliminates them from the feces. And so thereby the bile acid pool systemically and in the hepatocytes starts to slowly lower. And you see that, I say slowly, but it's actually pretty immediate. You see it within a couple of weeks. And as a result, you see the pruritus start to disappear. What we also see over time as part of the mechanism of action is xanthomas start to disappear. And so there's a certain percentage, I'd say 40 to 50% of kids that have xanthomas, which are these like debilitating lipid deposits under the skin. And depending on where they are and how big they are, they can be quite debilitating because they're often at the joints. And it can be problematic for development in children. And so these are driven by significantly elevated cholesterol. And when you reduce serum bile acids and you start to eliminate those bile acids out of the body, you break down cholesterol. And in the breaking down of cholesterol, you start to reduce the symptoms. So there's a lot of things that can be improved by the reduction of addressing the actual underlying problem, which is bile acids.